2 COVID-19 tests. Tested at least 62 players for the disease within just a few weeks. Joining us now, former Secretary of Veterans Affairs under President Trump, Dr. David Shulkin, and former Secretary of Homeland Security under President Obama, Jay Johnson.
So, Doctor, how can we best use, if you were in a position to use all of the resources that you had at your fingertips in the VA, what would you be doing right now to help avert this coming crash that so many experts are predicting will come to our hospitals?
Joe, the VA is the largest healthcare system in the country. It employs more doctors and nurses than any other system, and there needs to be a close coordination of federal resources with our local governments and our private sector hospitals. And we need to be thinking about our resources in a shared way. We're going to be asked to respond to a health emergency unlike anything that any of us have ever seen. And there needs to be a very integrated system of care. I think the biggest challenge we're going to have is staffing shortages. The VA itself already has 49,000 vacancies, but what we know from past pandemics is that about 35 to 50% of staff themselves won't be able to work because they themselves may be sick or taking care of people that they're responsible for at home. And so we need to coordinate our staff, our equipment, our physical space to begin to start addressing this. And every day that we don't have that coordinated planning is a missed opportunity.
Secretary Johnson, you, of course, ran Homeland Security under President Obama. I'm not going to ask you to play armchair quarterback, but just as a constructive question, what would you be doing right now if you were back in that chair? What would you be asking for?
Well, Willie, this is this generation's 9/11, without a doubt. I don't know everything that those in the Situation Room know or at headquarters at DHS know right now. I'd be concerned about asking the following things. One, we're seeing new cases every day here in the United States. Is that because of the actual spread of the virus, or is it because testing is becoming more prevalent, or a combination of both? I agree with what was said earlier by Joe and others. We cannot talk ourselves into believing that testing is not important. You need testing to know who has the virus, but you also need testing so you can track the virus in various different communities and know where we need to surge resources. The goals have to be flattening the curve, as we say, and in addition to that, encouraging the public to engage in social isolation, best practices in terms of hygiene. When you're in the chair, first reactions when you're dealing with a lethal virus, the spread of a lethal virus, are not always the best reactions. We can have an overreaction. For example, I have some real concerns about the implementation and enforceability of a shelter-in-place order by the government in a city as large as this one. New York is large and as complex a population as this one.
Which the mayor, by the way, in the city yesterday said, get ready, this is coming within 48 hours, perhaps.
Correct. And in a population like New York, as diverse and as dynamic as it is, by the time you think through all the exceptions you would need to impose to a shelter-in-place order to keep this city running, the exceptions would absorb the rule, and you'd quickly become consumed by the complexity of it all. So first reactions are not the best. In a situation like the one we have now, this is a national crisis, you need both political leadership as well as social engagement, social commitment, and public sacrifice. The public itself, through its own good behavior, can make the huge difference here in slowing the spread of the virus and keeping us all safe.
Do you think there comes a moment, because some public health experts have said this, where we look at those scenes of crowds on the beaches and people in bars and everything else, and you say, well, we can't trust everyone to abide by these guidelines we've put out, so at some point do what San Francisco did, shut the city down, or perhaps what New York City is going to do. Do you think there comes a moment where there's a national quarantine becomes necessary?
Well, I think at the national level in Washington, we have to fight the urge to try to come up with some one-size-fits-all solution. I think this has to be state by state, community by community, depending upon the nature of the demographics, the population, the workforce. But at the federal level, we can do certain things to encourage certain behavior. I think Dr. Shulkin is correct. We ought to be looking at the VA. We ought to be looking at each state's National Guard. I would not federalize the National Guard. I'd leave it under state control, but I'd put them in what is referred to as Title 32 status, where the federal government pays for National Guard support. But this has to be a community by community, state by state solution, engaging in social isolation and best practices, without a doubt.
Jeffrey Goldberg in Washington, jump in here.
Dr. Shulkin, just to stay on a theme that Secretary Johnson was talking about, if you had 5 minutes with Donald Trump right now, and I realize that that's a fraught idea, but if you had 5 minutes with him right now, would you advocate for a shelter-in-place order, either for a partial order across America or an all 50-state order? How do you feel about shelter-in-place?
Yeah, my concern is that seeing a doubling of cases now every 4 days, we are unfortunately beginning to follow the epidemiologic curve of Italy rather than South Korea. So I think that we do need to consider getting more aggressive. I think a shelter in place needs to be very geographically determined, but we cannot afford to sit idly by and to watch ourselves turn into Italy. We have far fewer hospital beds than Italy. I don't know if people realize that. Our hospital leaders right now in the private sector are doing an incredible job in preparing, but we are going to see staff shortages, equipment shortages, and if we want to save people's lives, we are going to have to get more aggressive. And I don't want to see us be a few days behind always. I think that we have to be looking forward. We see what's happened in the European countries, and we can't afford to stay on the same curve that we've seen over there.
Michael Steele?
Secretary Johnson, following on that point, how are you assessing not just the surge that we're clearly sort of girding for right now, but also what can be done in the private sector in the effort to get tests? Companies may have the ability to go out and purchase these tests that they can then bring into their community. Is there any thinking about that as we sit here and wait for the government to get its act together in terms of getting these test kits? Are there other ways in which people can access these tests globally?
Well, without a doubt, the pharmaceutical industry, the medical industry, the medical profession can, and I'm sure is, mobilizing to get test kits out in the communities more prevalent. We need to streamline any federal regulations, any resistance to getting this out there, to getting this done. If I were in the chair right now, I'd be saying to our team at the Department of Homeland Security, 230,000 people, okay, guys, you don't need more time, you need a deadline. When can we get this done, and what are the resources you need to get this done so we can release this in the private sector? And here's your deadline. I'm announcing it publicly in 10 minutes. And that's how you get bureaucracies to act. You give them a deadline and you make it public. And so I hope that at the national level at this stage, they got a slow start, is fully mobilized and looking at this in the correct way. The Stephen Miller mindset, which is if you have a problem in our borders, you regulate our borders, no longer works because the virus is here and the virus is growing.
Secretary Shulkin, we've talked about using VA facilities to get civilian patients in there. Let's not forget about the veterans themselves. Mika just reported that there have been 322 tests of VA patients, 322. The VA serves 9 million veterans, about half of which, as you know, are over the age of 65 and the most vulnerable populations. How do we make sure our veterans are being looked after?
Well, I couldn't agree more. My top priority and concern as Secretary was the safety of our veterans. We have 20 million veterans, while 9 million get their care through the VA healthcare system. We have a lot more out there. We actually have 350,000 World War II veterans, thankfully, still with us. And so this is a very vulnerable population. We clearly need to be more do more testing. We need to make sure that our veterans have access to the right health care, and that may mean getting more access to telehealth facilities rather than bringing them into our VA hospitals. And the VA has a big infrastructure for telehealth. So continuing to focus and make sure that our veterans are getting tested, make sure that they are getting the care that they need, making sure that when they need that care that these facilities are properly staffed and that there is coordination between the private sector and the federal government is going to be extremely important to ensure the safety of our veterans.
Former Secretaries David Shulkin and Jay Johnson, thank you both for being on the show this morning.
Thanks, guys.
And coming up, not that long ago, Republican Governor Larry Hogan took a hard look at running for president against Donald Trump. He ultimately passed on it, but still has plenty of thoughts about the current administration. Governor Hogan joins us to talk politics and pandemics ahead on Morning Joe.
I believe the food we eat tells the story of who we are and defines where we're going. I'm Andrew Zimmern. I'm exploring our country, looking at the biggest social and political questions of the day through the lens of food. Food-related illnesses are on the rise in America.
It's crazy to me that we talk about healthcare without talking about food.
Is the food we choose making us sick? I'll find out how food can make us healthier on the next What's Eating America, Sunday at 9 on MSNBC.
Meet the Ninja Foodie Pressure Cooker. The best of pressure cooking and air frying, now in one pot. And with Tender Crisp technology, you can cook foods that are crispy on the outside and juicy on the inside. The Ninja Foodie Pressure Cooker, the pressure cooker that crisps.
Unpredictable Crohn's symptoms following you? For adults with moderately to